ladies and gentlemen. Please let me know if I'm audible.
Yes,
Yes,
you
we're
are audible.
fully audible.
Yes.
Thank you so much, Gani. Thank you so much. Welcome everyone to the very first parallel session for today. We are here in hall number 3 for technical session 3. The title for this very technical session is Public Health Emergency and COVID-19 Risk. I am Neshma Tuladar. I welcome you again to the Second International Symposium on Disaster Resilience and Sustainable Development Day 1, Technical Session 3. As a rapporteur, we have Mr. Jiten Kumar, who will be supporting us all the way from Indonesia for this very session. Basic key points I'd like to mention before we head for the session. The Zoom session is being recorded. The recorded session will be made available on request. Please mention if you have any objections or so. The technical session chairs will be responsible for announcing the presentations and respective presenters. We will have the discussion and Q&A session at the end after all the 10 presentations take place per session. The participants can post their questions and queries in the chat box. I'd like to request the presenters to keep the track of the chat box and answer the ones that will be directed to you. If not, we will be having the discussion at the end of the very session. So please, ladies and gentlemen, help me in welcoming the very first co-chair for this very technical session. We have Dr. Sylvia Zabo, who works as a research professor at Dongguk University, South Korea. Previously, she was with the Asian Institute of Technology, Save the Children, University of Southampton, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Her current research focuses on human-environment interactions and rural development and social policy. We have also our second co-chair, Dr. Victor Ho, who hasn't actually joined the session yet. We will still be continuing, and as soon as he joins, we will hand over the session to him as well. He's currently the council member for the Academy of Occupational and Environmental Medicine and the College of Public Health Medicine, executive member of the University of Malaya. Executive member for the Malaysian Medical Association and the Asia Pacific Academic Consortium for Public Health and the International Commission for Occupational Health, National Secretary, Malaysia. So I've already announced some of the key points to be considered by the presenters and the chairs. So over to you, co-chairs. We have two honorable dignitaries here along with us. Over to you, respected chairs. Thank you.
Thank you very much, Neshma. I think I have no choice but to start since my colleague, Dr. Victor, is not here. I think no one is actually switching on their video, so maybe I'll also switch off because the background is not very appealing, so apologies for this. And as we are very delayed, I think we are going to start very soon now with, we have 10 presentations in total on a very exciting topic of public health emergency and COVID risk. So without further ado, let's start with the first presentation, and after we have all the presentations, hopefully we'll also have a short Q&A session. So let's start with our first presenter, Mr. Vorvat Siverstedi, who is the PhD candidate at the Asian Institute of Technology, and he is going to present to us a paper on the impact of COVID-19 measures on the trade flows. So, Vorvat, the floor is yours. Please proceed with your presentation.
Presenters, this is an announcement that we already have your recorded presentations. So I will be playing all the 10 presentations from AIT itself. All the presentations are in line already. And as soon as the co-chair announces, I will be playing it from here. So with your permission, co-chair, I'd like to play the presentation. Meanwhile, I'd like to request all the participants here to please mute their mic. Thank you to avoid any kind of disturbances in between. Thank you very much.
Hello, everyone. Okay, I hope you can hear me. My name is Warawat Sisawat. Today I'm going to present about my research, and the topic of the research is impact of COVID-19 public measures on country level trade flows, a global panel data analysis. Let's begin with the introduction. By the end of 2020, around 85 million people worldwide were infected with COVID-19 and almost 1.8 million people died as a result of COVID-19. More people are now living in extreme poverty as the global economy experienced sharp contraction in 2020. The number of new COVID-19 cases continues to rise at an alarming rate, and many countries have already experienced several pandemic waves. The rapid spread of COVID-19 and the measures implemented by the governments to contain the pandemic have had serious consequences for the world's economies. There's still limited research regarding the possible associations between COVID-19 government measures and trade flows. So the research objective is to identify the impact of COVID-19 government intervention measures on global trade values. There are three hypotheses. Hypothesis one is containment and health related policies have positive impact on trade flows. Hypothesis two is stringent measures on closure and social distancing measures have negative impact on trade flows. Hypothesis three is economic support measures lead to an increase in trade flows. The model employed for the analysis is called the random effects regression model. The random effects model is applicable in the context of analyzing the data with characteristics that fits the panel data. Random effects model is used when the data has observation units of two or more groups observed over two or more periods of time. An advantage of the random effects model is that it allows for including of time invariant variables such as gender. In the fixed effect model, these variables are absorbed by the intercept. And in this study, the data consists of 70 countries observed over a period of 9 months, so it fits the panel data description. The dependent variables in this study include export value, import value, and total trade value. The explanatory variables include the policy index, which include containment and health index, stringency index, and economic support index. The specific policies include school closing, work closing, public event canceling, gathering restrictions, stay-at-home requirements, domestic and international travel restrictions, income support, debt relief, public campaign awareness, testing policy, and facial covering. We also include controlled variables such as GDP, population size, population density, percentage of poverty, life expectancy, and surface area. And here are the results. According to the results, containment and health index show positive impact on trade flows. On the other hand, the stringency index shows negative impact on imports, export, and total trade. For the control variables, GDP as well as a surface area show positive impacts on the trade flows. For the specific policies, school closing policy shows negative impact on imports and total trade. Stay-at-home policy shows negative impact on imports and total trade. The testing policy shows negative impact on export. For facial covering shows positive impact on both the imports exports, and total trade. And GDP and surface areas are the control variable that show positive impacts on total trade. Here are the bar graph that illustrate the effects of the policy indices and the specific policies. So we can see that, for example, containment and health index shows positive impact on trade, and stringency index show negative impact on trade. And for specific policies, school closing, work closing, stay at home, public campaign awareness, and testing policy all show negative impacts on trade. And public event cancel, restrictions of gathering, restrictions on domestic travel and international travel, and facial covering all show positive impact on trade. Here's the spider chart that shows the COVID-19 government intervention indices. So we can see from January to March, the government intervention indices are still very low. And from April onward until September, the government intervention indices increase significantly. This graph shows the number of COVID-19 daily cases from January to September, as well as the COVID-19 daily death by regions. The regions include Africa, Asia, Europe, North America, Oceania, and South America. According to the graph, we can see that the regions with the highest number of daily cases and deaths include Asia, Europe, North America, and South America. And regions with relatively low number of daily cases and deaths are Oceania and Africa. Okay. So let us discuss about the results. So according to the results, the findings showed that better containment and health policies implementation represented by containment and health index show positive impact on trade flows. The government stringent implementation on closure and social distancing represented by the stringency index show negative impact on trade flows. And economic support measures do not show significant impact on trade flows. For specific policies, facial covering showed a significant positive impact on trade. On the other hand, school closing, stay at home, and testing policies show negative effects on trade. So our recommendations are future research can choose to explore on examining the impact of COVID-19 government measures on other economic sectors, such as a tourism sector or manufacturing sector. And the government should focus on better implementation of containment and health-related policies, as well as maintaining less stringent measures on closure and social distancing in order to minimize the negative effects on trade flows. For the economic support, while the economic support measures do not show significant effect on trade, these measures can be effective to relieve the financial stress of households and individuals during the pandemic and also boost consumption. This is the end of my presentation. Thank you very much. Please feel free to ask any question.
Thank you very much. Thank you very much, Voravat. I don't know if Dr. Victor has joined already. If not, let me introduce the second presenter from Malaysia now, Dr. Anatul Fatihia binti Abdul Rahim, and he will present paper entitled A Thematic Review on Health Emergency Disaster Risk Management, Strategy for the Application of Health Emergency Disaster Risk Management in Malaysia. So that's also, I think, a recorded presentation. Okay, let's go ahead.
Hi everyone, my name is Ainatu Fatia binti Abdul Rahim. I'm a candidate PhD in Bioenvironment in IIUM Malaysia. Together with my supervisor, Assistant Prof. Dr. Irina Safitri Zain, as well as from IIUM. So today we are going to present the paper titled about a thematic review on health emergency disaster risk management, a strategy for the applications for the health emergency disaster risk management in Malaysia. So in regards for this, for the introduction here, so according to the WHO dashboard, it was been reported about 3,412,000 of the total death was being reported. The COVID-19 pandemic has tested the country public health system in coping with the multi-scale and massive health impact on the human lives. Therefore, it requires an urgency to provide a basis for coherent action by building resilience and the health security for the communities and the country's public health system. Why is it important for the having a public health system? Because the health system is undertaking all the organizations, people, actions that primarily intend to promote, restore, and maintain health. Therefore, the WHO developed the Health Emergency and Disaster Risk Management, or we call as Health EDRM, in 2019 to provide the global guidance to countries on putting in place the capacities and functions within and across health and other sectors as well. So with the Health EDRM is actually the term described by WHO that captures the broad intersections of the health and disaster risk management. It is derived from the disciplines of the risk management, emergency management, epidemic preparedness and response, and health system strengthening. It is fully consistent with and helps to align the policies and the actions for the health security, disaster risk reductions, humanitarian action, climate change, and sustainable development. So the expected outcomes of the health EDRM is that the countries and the communities have stronger capacities and system across health and other sectors, resulting in the reductions of the health risks and consequences associated with all the types of emergencies and disaster. So these are the materials and method to accomplish of this paper. We are actually using the thematic review using the Atlas TI-8 as the tool as being introduced by the Zyro 2020. It is implemented because the method of the study applies the thematic analysis procedure in the literature review. So according to the Clark and Brown 2013, it's defined that thematic analysis is process of identifying the pattern and the construct themes over through the readings on the subject. So the step is actually to identify the pattern on how the applications on the health emergency disaster risk management in several countries. So the tenets of this research are to analyze and interpret the findings for the recommendation for the future research in the health EDRM. So the selections of the literature was performed according to the several selection criteria. So the first criteria is the publication from 2013 to 2020, and the keyword that we are going to use is the health emergency disaster risk management, focusing on practices or applications, and the decision is to limit the countries of the origin was made to help define the strategy of the health emergency disaster risk management has been carried out. So these are the search strings that we are using. We are using the phrase searchings, Boolean operator, and the truncation as well as the wildcard. So these are the from the initial research, we found out with 86 articles from the Scopus and 14 articles from the ScienceDirect, and from that article, 75 articles were removed due to their premature results, and anecdotes were not discussing practice and response on the health EDRM, and some also are not found incomplete, and it's not have a broken link and overlap, so it is incomplete. So the final paper was been reviewed about 25 articles, and will be presented in the table 1 1 in result and discussions, and then it will be uploaded in the Atlas DI and was being operated and finalized into this. So these are in the result and discussion. It was quantitative results. So these are the table that has been discussed. So these are by using the word cloud that have been generated, and these are the articles based on the country via a graph, and these are via year. The trend are showing increasingly. So these are the in the qualitative results. So these are all the actors and the countries that has been discussed, and some of the strategies that has been discussed. We have Thailand, Malaysia, Vietnam, Indonesia, and African. And from all these strategy, they are actually reflecting from the perspectives of the theories, the limitations of the Sendai framework disaster resilience, and they came up with the specifically how the action will be taken throughout the multi-sector organization, as well as the government, media, and some of these others respective bodies or international bodies who able to contribute to this strategy. And this is also from the strategy of the health EDRM application in several countries. So we have the Belgium, China, Philippines, New York, South Korea, Canada, Pakistan, China, and specifically Hong Kong for the China. So from these application, it shows a lot of techniques, tools, models that they have been used in a way that they are focusing on some of it from health perspective, as well as some from these the metadata, and some was from the policy, the action to integrate with the decision making as well. So in conclusions here and the recommendations here, it seems that the current mechanism and strategy for disaster resilience as outlined in the Sendai Framework Disaster Reduction should be enhanced as to respond to the global pandemic such as COVID-19, and the need to integrating the new framework of the health EDRM, which they have the 10 core components. In this regards, from the review, it's worth noting for Malaysia government to plan a strategy and make several general and DRR specific recommendations in order to in line with the global policy framework for the health EDRM and its applications from the above countries mentioned. And these recommendations should concerns knowledge and science provision in understanding disaster and health related with the emergency risk. And it's actually provide the extensions of disaster risk governance to manage both disaster risk and potential health emergencies, particularly for humanitarian coordination aspects, and the strengthening for the community level preparedness and the response. So that's all for my presentation, and these are all the references that my helping for the throughout the paper, and anything will can contact us.
Okay, fantastic. Thank you very much. So now we are moving to number 3, a presentation by Kotchakorn Kruphong, a framework of risk profile in public healthcare system management, a literature review. Welcome. Please proceed with the talk.
Greeting to all participants and committee of the second Symposium of Disaster Resilience and Sustainable Development 2021. My name is Kochakon Krupong, Master Degree student of the Risk and Disaster Management Program, Chulalongkorn University, and a member of the Disaster and Risk Management Information System Research Group, Chulalongkorn University. Today's presentation is a framework of risk profile in the public healthcare system development, the literature review. The co-authors of this research are Dr. Jing Tang and Dr. Nat Lilawat from the Faculty of Engineering, Chulalongkorn University. Start with the definition of the word, the risk profile, which is mentioned in the different of the research and study field about the risk profile development and the risk profile implementation. Has the common definition of the risk profile as the results of the risk assessment process. From the dictionaries, the part of business dictionary, the risk profile, the amount of the risk that that is involved in an investment or an analysis of how safe a person or company to lend money to. And there has the idea of the risk management in the international framework in disaster risk management supported by UNISDR or the UNDRR has the guideline of the development of the risk profile. And the important part is the risk equation, which risk equals hazard multiplied by the vulnerability and divided by the capacity, which means the higher of the hazard and vulnerability will also increase the level of the risk, but the capacity of the risk will affect differently. The research methodology will start with the demographic review. You show the trending of the research ratio by the field of study. To select the review paper, we will select the top 10 of the relevant paper from each field of study. Next, we conduct the SWOT analysis as the analysis part of this research. And then we go for the discussion part. And in the end of this research, we'll go to conclusion and the succession. The findings start with the demographic of the study about the risk profile between 2011 to 2020. The number of the research articles related with the risk profile has increasing in every year. And until 2019 to 2020, which is the gap of the year that have the more number of increasing in this year, might be from the COVID-19 situation. Pandemic start in the end of 2019 and increase to the world pandemic in 2020, produce more risk to all of the operation around the world. On the right, the demographic of the risk profile research articles during 2011 to 2020 also. They will filter by the country and territory from Scopus. Found that the United States has the high ratio of these research articles. 21% of all of the research related with the risk profile. Next is the ratio of the field of study. You see that both of these database has the same number of the first field of study. From the ratio that you see, it is 57% of the risk profile research articles. The main part of this research is the SWOT analysis. I will separate the SWOT analysis into the 4 groups of the field of study in this presentation. First group is the group of the medicine, dentistry, psychology, and the other health science. The strength of this one starts with a specific and exact trigger event and the statistic in the record. Next is the weakness. The weakness is the limited variables. The opportunity of this field of research is the potential to calculate the value of the risk level and the potential to increase the number of variables in the future. For threat, there is more related factor in the future that might be added and the conditions of the specific variable that might be changed in the future also. Next group is a group of economics, finance, and statistics, and the other field of study which more related with the number and the value. The strength of this field of study start with the risk rate and level of calculation and potential, prove the theory and forecast the future. It is a strength of this field of study to develop the risk profile. The weakness, they has the limited of perspective, has a limited of variable in the study, same as the medicine and dentistry group. The opportunity, they have the potential to calculate the value, which is more exact and very numerous. The threat, they have more complex possibility that's able to affect the calculation. If there is some number that wrong from the theory or something, they might be affect the calculation that also affect the risk level that they can calculate. Next group of study of social science, marketing, and the human behavior. This one they had a strength, has the interdisciplinary in the development because they have to put the focus on the different perspective to understand human behavior or a lot of factors related. For the weakness, they also have the limited variables they interested in. The opportunity, they has the possibility to adapt with the interrelation system, and the threat, more related factors in the future that may involve. And the last is the multidisciplinary. The strengths, they has the variety of the perspective of risk assessment, has the guideline of the process of the planning. The weakness is too wide. for a specific area or system. Also, they have the complexity of the relations between the factor and variable. The opportunity has the possibility to adapt with the interrelation system for the other system in the future. And the threat, they may have more related factor in the future that they have to find a way to connect it together. For discussion, we also discuss about the difference of the risk profile development. First, we can separate it by the scope by the area of the study. First, for the wide area in the country's level or the city level, an area of the specific area, they try to study the factory, the group of people which have smaller and less complexity to study. And next way to separate the group of the risk profile development is data collection. We will separate from the data from history, analyze from the previous data, data from the current time, from the data collection and survey. For the conclusion and the suggestion, first part is the adaptation. To adapt with the disaster risk profile development, they need to select the appropriate guideline. As shown in the SWOT analysis, that different of the field of study has the different of strength, weakness, opportunity, and threat that may affect to the risk profile guideline development. Disaster risk profile needs the complexity guideline both in data collection and risk assessment. So they have to find a guideline that's able to use with the complexity operation system. For the related stakeholders, management organizations, government organization, and the policy level from the every organization that needed. And another related stakeholder is the researcher who is interested in the risk profile development. And the risk profile development, it will be benefit to both of the operation level and the policy level up to the concept of development process and guideline that I already show in the SWOT analysis. Thank you for your attention.
Okay, thank you. That was a nice literature review. And now for the next two presentations, we are moving to India. So first we have Odisha, and the second talk is more about the Indian response COVID-19 as a disaster. That is the second talk, but the first talk is slightly different. It's a different topic. It's pesticide use pattern and health impact amongst farmers and laborers during the pandemic. So let's proceed with this talk now.
Hello everyone, I am Nishikant Kumar from the University of Newcastle, Australia. Today I am going to present the research paper entitled Pesticide Use Pattern and Health Impacts Among Farmers and Laborers in Kalahandi district of Odisha, India. As we know that pesticide is one of the most integral and essential part of the human being. In spite of it has many advantages, it has also many disadvantages like excessive and indiscriminate use of pesticides resulted into the human and environmental health impact. Further, poor handling of pesticide also another reason of pesticide exposure. According to the World Health Organization, across the world, around 30 lakhs pesticide poisoning cases and 2,20,000 death cases reported, and majority are reported from the developing countries. Coming to India, around 70% population engaged in agricultural sector, and the consumption rate in India is quite different from the global scenario. In India, consumption of insecticide is more than the herbicides, but globally it is opposite, where herbicide consumption is more than the insecticides. Further, there is a problem like lack of data in India regarding pesticide-related health impacts and pesticides consumption. The study objective is to understand the pesticide knowledge, use practices, and health impacts among farmers and agricultural laborer community. You can see from the map of India, Odisha state is located in the eastern part and the Kalahandi district situated in the southwestern part of Odisha. Paddy cultivation is one of the major crop cultivation in this steady region. To fulfill the objectives, the study required to conduct qualitative method. The samples were selected based on multi-stage random sampling. Total participants were 40 and the semi-structured interview conducted which lasts for half an hour for each interview. Farmers and laborers were participants. Themes were identified from the transcript data through thematic analysis approach. Categories and higher codes were developed from the similar themes. The score were assessed qualitatively, quantitatively, and analyzed as continuous and categorical. Health building model also used to analyze the study result. In the result section, the table shows the demographic profile and pesticide poison. Majority of the pesticide participants were aged between 20 to 60 and the cases also found among them more. Most of the farmers were educated but still they were exposed by the pesticide. 76% farmers belong to the subsistence cultivation group and these are the groups where poisoning cases is most. Further, roadside and water body are the places adjacent to the cultivations land. Marginal and small farmers are found most poisoning cases than large and medium farmers. Here, this table shows about pesticide knowledge and health impacts. 70% farmers knew about the pesticide doses in an acre of land. The most common doses are below 200 ml in an acre of land. All the participants were using pesticides, but among them 40% says it's very harmful in nature. Again, information about the risks of pesticide was very poor from the government side. Headache was also very common system found among the farmers after applications. And related to the pesticide poisoning and death in their family, very few cases found among the family of the participants. This table shows about pesticide use practices and their health impact. Majority of farmers apply more than 4 times in a year, and poisoning cases also found among these groups. More than 50% farmers were applying pesticide with normal clothes and half-naked body. Because of poor practices, poisoning cases are more among them. These are farmers of 30% who were not able to read the levels of pesticides container. Storing pesticides container inside a house is found among majority of farmers and poisoning cases also found among this group. Throwing in an open place to empty pesticide container is most common practice also found among this group. The majority were doing the dangerous practices of mixing pesticides in an open hand. The case of poisoning case high among this type of farmer. In 2014, a research paper also found the similar result that subsistence farmers are more exposed to pesticides and found poisoning cases than commercial farmers. One of the oldest studies found in the similar result that socioeconomic conditions also hinders the farmers to use protective clothes. JALUS in 2016 also found that most reported poisoning cases among those who keep pesticide inside the houses. Not receiving pesticide training from the government department also found in the study of the dermalers in the year 2016. The study will be helpful to reduce pesticide exposure among the farmer community through policy intervention. This is the health belief model that we applied for our study. It explained that education and holding and land holding are modifying factors. Perceived threat of disease are like headache, vomiting, skin and eye irritations. Again, when farmers perceived about threat of disease, they take actions. Some were able to do positive actions, some were not able to do that. This happened because of socio-economic and environmental factors. Thank you, everyone.
Thank you very much. Let's proceed directly with the second case study in India.
Warm regards. Myself, Dr. Shatabdi Dash, Assistant Professor, Department of Political Science, South Calcutta Girls College. The name of my presentation is COVID-19 as a disaster in Indian response towards the public health emergency. As we all know, a disaster is a sudden calamitous event that seriously disrupts the functioning of a community or society and causes losses that exceed the community's ability to cope using its own resources. And this pandemic, people experience the same situation during this COVID-19 pandemic. Against this backdrop, my study shows light on how India's perception of the pandemic as a disaster is shaping its response to it, the significance of the need to invest in more comprehensive disaster mitigation, the repressive state machinery, and the prospect of attaining sustainable development goals in India during this pandemic. The World Health Organization is working closely with global experts, governments, and partners to rapidly expand scientific knowledge on this new pandemic to track its spread and its virulence as well. And it called it a pandemic, a public health emergency as well. And the first case of COVID-19 infection reported in Kerala, India on January 27, 2020, as India is the case in point. So it is very evident that how the pandemic hit the country as a whole. And there are some graphs that I will show through these slides that how the pandemic is affecting the country, as the country faced both two waves, the first and second wave. This is the age-wise breakup of younger COVID-19 patients, first wave versus second wave. The color legends has shown it all. The COVID pandemic, if we consider it, that India's daily COVID-19 death count in May, June, July 2020, it has its peak. In April 2021 during the second wave, it has also its peak. And this is the India's daily new cases and 7-day average. And we can see that in May 2021, it has its peak, that is second wave. And India, the country, used various legal instruments to deal with the situation. For the first time, it has been declared as a national tragedy, and the country invoked the Disaster Management Act of 2005 along with the Epidemic Act of 1897. There is some questions from different sectors that the applicability of Disaster Management Act, but as the country does not have a consolidated public health emergency regulation, so India used these as the guiding principles. And the Epidemic Act had been amended in September 2020. This amendment basically helps provide protection for health care workers, and expansion of powers of the central government to help fight the pandemic and other such diseases. And for those who are flouting the rules have been punished under this law as well. And the invocation of this law also helped in declaring a nationwide lockdown in during the first wave and during the second wave as well. Though for the time being, the lockdown has some positive impact on the environment due to the shutdown of industrial activities, the halt of transport, but it has its negative impacts on the human beings also. It has the worst economic turmoil all over the world due to the prolonged lockdown. Unemployment rose sharply, and a large proportion of workers in India work in the informal sector, and preliminary estimate indicates the job losses for this category of workers range from 25 to 56%. A large section of unorganized labor who works as migrants in cities could not return to their families due to the sudden declaration of national lockdown, and there was a repressive state measure came into being. Reports of police harassment, intrusive surveillance were there, and all of them have some negative impact on the humans, but there were no other way to combat the crisis as well. And India's policy responses to the pandemic is that the essential services were maintained throughout both the first and second wave of the crisis. Various schemes have been announced by the Prime Minister, like the Atmanirbhar Bharat scheme. And during the announcement of this scheme, there are a lot of basically the schemes were outlined aiming to aid the poorest of the poor with food and money in hands, while making them capable of buying essential supplies and meeting essential needs. And by declaring Atmanirbhar Bharat, at the same time when announcing that, it was said that vocal for local through measures called the 4 L's, that is the land, law, liquidity, and labor. And during the second wave, there were steps taken for the transfer and transport of equipment, because there were lack of medical equipment throughout the country, and the massive vaccination drive as well. It was divided into 3 stages. First, the frontline workers, then the people above 45, and then 18 to 44. And now the trial of children vaccination is in pipeline. And the pandemic, during pandemic, there are some positive impacts are on some of the SDGs, and there are negative impacts on some of the SDGs. The number is more in negative impacts. Positive impact due to the lockdown, in the halt in industrial activities, climate action scored very good marks, and life below water and on land are saved. But negative impacts is that the unsustainable and bad development policy has been catastrophic on India's poor. Lockdown disruption in supply and distribution channel of food. The voluntary distribution of grains are not sufficient. There are inequalities because the rural and urban disparities, differences exist between salaried and daily wage earners, intra and interstate differences in getting the help of medical equipments, and the confinement and quarantine existence increased the domestic violence. Women who are the primary caregivers, they are getting infected more. And education, regarding education, due to digital divide, people living in the remotest corner of the country cannot get in touch of the online teaching, so the online teaching process is hampered. And so these are the SDGs are very much hampered during the pandemic in India. And the road ahead is that building more resilient health infrastructure, because during the second wave there was astonishingly lack of medical equipment, oxygen cylinder, hospital beds. People were dying outside when waiting outside the hospital and in need of beds. And the strategies of combat the disease, that is the lockdown. There should be more humanitarian friends, though during the second wave there are certain steps were taken regarding this direction, and recovery policies must include the key concern for SDGs, that is leaving no one behind. So the health crisis unleashed by the pandemic represent a very serious challenge. In some sectors, the country responded positively, but much will depend on how the pandemic pans out, the availability of a vaccine, and the public's a response. And at the same time, the pandemic represents an opportunity to carry out reforms that would not have been possible under more ordinary circumstances. So the state's ability and preparedness should be built up in order to combat the pandemic as a disaster more. Thank you. Stay safe, stay well.
Yes, thank you very much. If you are online, thank you for this interesting presentation. And now we have a slightly different aspect. We focus more on business continuity, so it sounds quite interesting. We invite Dr. Shohei Benia, who is going to present on who's got results from a comparative study on business continuity and response to infectious diseases of public listed companies in Japan. So we listen to your presentation, Doctor.
Hello, I'm Shohei Benia at the University of Hyogo, Japan. Today, I'll give a presentation about this title. An infectious disease pandemic like COVID-19 is one of the biggest risks of business continuity. But such pandemic is very rare. This study focuses on the case of Japanese listed companies at two pandemics, the H1N1 new flu pandemic in 2009 and the COVID-19 pandemic. I would like to share our experience with you. This slide shows summary of conclusion. Possession rate of infectious disease countermeasure plans was proportional for company scale. The infectious disease countermeasure plans were effective against COVID-19 pandemic. The business impact by COVID-19 pandemic was greater than that of the H1N1 pandemic. Especially, the decline in sales was large in the transportation and warehousing industries and material industries. In the case of COVID-19 pandemic, many companies took measures to promote work style reform, such as remote work and staggered work hours. So we conducted 3 questionnaire surveys. At the time of the 2009 new flu pandemic, we conducted 2 questionnaire surveys. One is 2008, the other is 2010, before and after the pandemic. Targets were sampled public listed companies on the first section of the Tokyo Stock Exchange, Japan. The first section is only for Japanese large and excellent companies. Then we conducted a new questionnaire survey for COVID-19 in 2020. The targets are all public listed companies in the Kinki region, Japan. Please note that target companies were different. At first, possession rate of infectious disease countermeasure plan before the pandemic. As a trend, possession rate of the plans were proportional for company scale as number of employees. There was no big differences between 2009 and 2019. And this slide shows effectiveness of the infectious disease countermeasure plans. In the case of COVID-19, 75% of companies with plans evaluated that their plans were effective to the COVID-19 pandemic. And then this slide shows challenges of the companies. As a trend, companies without countermeasure plans had more challenges in responding to COVID-19 pandemic. For example, difficulty in deciding about the cancellation of events, business trip. There is a 28-point gap. This slide shows business impact. So 33% of companies with plan had increased their sales. 15 points more than the companies without plans. So the plans were effective. Then this slide shows differences in business impact. We defined business impact index, increase in sales minus decrease in sales divided number of target companies. And business impact index are less than or equal to 0, especially transportation, warehousing, and material industries such as steel, metal, chemical, petroleum were damaged seriously. This slide shows progress of countermeasures in the pandemic. Horizontal axis shows increment of countermeasures in the H1N1 pandemic. Vertical axis shows increment in the COVID-19 pandemic. And this line is 45-degree line. The further away from this line, the greater the difference between the two pandemics. And please see these 3 8 circles. In the COVID-19 pandemic, many companies have taken measures to promote work style reform, such as remote work, staggered work hours, and video conferencing system. And this slide shows the challenges of the companies in two pandemics. The biggest differences was this difficulty in obtaining hygiene materials, which was due to the global demand increase and supply chain disruption in the case of COVID-19. And this slide is last, business impact by two pandemic. Business impact by COVID-19, this blue bar shows was bigger. More than half dropped their sales and 1/4 increased. That's all for my presentation. Thank you very much.
Thank you very much. And I see you are online also. Thank you very much, Dr. Shohei. I think it brings a new aspect to this debate with the focus on businesses. So that's been very interesting. And I'm sure there'll be questions later to you. Now we move to the next presenter, Mr. Tuchara Kamalratne, who, if I'm not mistaken, is a PhD student at the University of Huddersfield in the UK, with the presentation on a study on the need for an effective detection and early warning mechanism for resilience pandemic and epidemic response. Let's listen to you now, sir.
Greetings to all of you. I'm Tushara Kamalratna. This research paper is about the need for an effective detection and early warning mechanism for resilience, epidemic and pandemic response. Lessons from COVID-19 pandemic. Professor Dilanthi Amartunga and Professor Richard Hague are co-authors of this research paper. As all of us know, the entire world is in a dysfunction since 11th March 2020, when the WHO declared a global pandemic as unprecedented health and socio-economic issues emerge with the outbreak of the severe acute respiratory syndrome coronavirus 2, which is commonly known as COVID-19 virus. The need of robust pandemic and epidemic early warning and preparedness has been widely discussing in the current COVID-19 pandemic, which has been unstoppably spreading with a shorter time span across the world. The severity of the pandemic outbreak is significant and alarming due to the sudden emergence of different variants or strains which carrying new mutations of the COVID-19 virus. Brazil variant, UK variant, known as Alpha, South African variant, Indian variant commonly known as Delta, and recently identified Thai variant are some of the later detected strains. Early detection of pathogens and dissemination is critical as many of several countries already have experienced the epidemic in pandemic. For example, India is suffering from a deadly black fungus, yellow fungus and white fungus issue. Sri Lanka also suffering from dengue amid of the COVID-19, where the whales found 2 monkeypox cases amid of COVID-19. 2 recent experiences in Slovakia and Bahrain shows that detection and early warning is the most critical and challengeable part in pandemic preparedness and response. Slovakia being the first country tested entire population for COVID-19, and after 1 month, Slovakia had the highest 7-day rolling average of daily COVID deaths per 1 million people in this population by the first week of March 2021. Similarly, Bahrain maintains 109 vaccination progress, but the country has been facing an alarming rate of COVID-19 hike currently, indicating that how consistent and effective disease surveillance and early warning is vital in pandemic response. Objective of the research paper is to explore the main elements and key stages of epidemic and pandemic early warning through literature and identify the critical elements in order to analyze the interconnectedness between different elements in an effective epidemic and pandemic early warning mechanism. Let me explain methodology and procedures of the research briefly. This research is a complete desk study. A systematic literature review was conducted using 3 electronic databases known as ScienceDirect, Scopus, and PubMed. Literature mining process was initiated at 3 independent instances. The syntax which was used for the Boolean operator was detection or early warning or dissemination or epidemic or pandemic or COVID-19 or pandemic response. The literature mining was carefully restricted only for published peer-reviewed research articles, and time restrictions was applied from 2005 to up to date. Further, areas were limited to social sciences, environmental science, technology, and media and information management. Finally, 48 papers were selected for the analysis, and a set of grey literature also were used in analyzing part. This is the Prisma flow diagram for article mining process. Here you can very clearly see how was the article mining process was conducted. Now let me briefly present you the key findings of the research. Several research highlight that detecting and analyzing the nature of the pathogen is the most important step within the early warning process as it expedites the response action. An effective early detection and warning always lead to effective response as early action can be taken in the pace of epidemic and pandemic preparedness. However, late response of inadequate initiation in many disease surveillance and detection has resulted in an unexpected outbreak of infectious diseases. In addition, epidemic and pandemic arise from a wide range of origins, pathogens, and drivers, making their prevention and preparedness very complex. Therefore, several research highlight that detecting and analyzing the nature of the pathogens is the most important step within the early warning process. It seems that high-impact outbreaks have been caused by viruses, for example, COVID-19, HIV/AIDS, Ebola, Zika, and pandemic influenza are virus diseases. Similarly, majority of emerging infectious diseases outbreaks are caused by bacteria, for example, plague, anthrax, cholera, typhus, fungi, or helminths. Emergence of pathogens or epidemics are not new. There were thousands of epidemic outbreaks have reported only during past 2 decades according to the WHO report. Severe acute respiratory syndrome, which was commonly known as SARS, H1N1, Middle East respiratory syndrome known as MERS, Ebola epidemic, Zika virus, plague, some of them were. According to the WHO record, 1,307 epidemic events have been reported only in between 2011 to 2017 due to 20 transmissible infectious diseases. As a trend, re-emerging the infectious diseases is notable, and especially Zika virus, meningitis, monkeypox, influenza A, and Crimean-Congo hemorrhagic fever have been gradually increasing during the period. 5 basic pillars of a functional early warning system can be identified, which is very common for both epidemic and pandemic. Screening of raw data and information, triage of relevant information and risk assessment, alert and early warning, effective response, and preparedness are those 5 pillars. However, we need to really concern about the epidemic phases and the response interventions identified by the WHO in implementing a functional early warning system. What you can see here is the key stages of pandemic response mechanism identified through the literature survey. Epidemiological surveillance and detection, primary screening of raw data and information, risk and vulnerability assessment, prediction and decision making, alerts and early warnings, response, it includes control and mitigation, preparedness, which has preventive strategies, both medical and non-medical, reduce transmission and eradication, and finally post-pandemic phase. However, the first 5 elements are interlinked in the process of early warning and dissemination, which is identified to be more significant in pandemic preparedness and response. This is an extensive framework developed based on the elements identified through the literature review. So you can see here, starting with the epidemiological surveillances and detection, the both zoonotic and climate surveillances are interlinked. And then here the primary diagnosis, actually it is based on the screening raw data and information. So this is where you can basically start the alerts and early warning, which identified as the primary alert and early warning phase. And once the risk and vulnerability assessment and the prediction done, so then you can issue the second warning or the alert, which is called the secondary warning. So then the preparedness and preventive strategies, both medical and non-medical countermeasures, and the response, the control and mitigation process, the finally elimination or eradication. On the other hand, you can see the phrases identified the WHO in the context of the epidemic also highlighted here, you to understand how these the conceptual framework is running through the particular phrases. Here is the conclusion. We can summarize the conclusion with 3 main points. 1. An effective detection and early warning are the key to epidemic and pandemic preparedness and response. 2. Robust detection and early warning mechanisms provide timely warning and dissemination for early actions in response. 3. Necessary elements and stages of detection and early warning should be well defined and understood for mitigating risk and vulnerability in epidemics and pandemics. Thank you very much. These are the references that we use only for the presentation.
Yes, thank you. Thank you for this very interesting talk. And now we move to the next case study in India, a multi-level spatial analysis and mapping of child malnutrition outcomes and determinants. So slightly different perspective, and I'm curious to see whether already we have analysis from the COVID period on this topic. Let's proceed.
Good afternoon, everyone. My name is Randy. I'm working as a program coordinator in Asian Institute of Technology. I'm really thankful and I express my gratitude for the organizing chairperson and organizing committee for the second International Symposium on Disaster Resilience and Sustainable Development. So now I'm going to present my research. I'll try my best to be crisp and finish in 8 minutes. Please excuse me if I take 1 minute extra, 1 or 2 minutes extra. So my topic is on multi-level spatial analysis and mapping of child malnutrition outcomes and its determinants in India. So what is malnutrition? Malnutrition is mainly the imbalance between food taken by our body and food needed by our body. Malnutrition, when we consider malnutrition, we think only undernutrition is main thing of malnutrition, like main outcome of malnutrition, but overnutrition is also considered as a malnutrition. But to this study, I'll be focusing only on undernutrition, that too for the age group of 0 to 5 years. But the main indicators for malnutrition are manifested from the growth failure, from the image you can see here, that is wasted, stunted, and underweight are 3 major indicators which are seen for the malnutrition. Like wasted is like low weight for the height, stunted is like low height for the age, underweight is low weight for the age. When I say age, it's 0 to 5-year age group. This is a global scenario of malnutrition. Around 150 million children around the world have been facing malnutrition, and mainly affected by stunting, that is low height for the age. Around 35% is contributing from are coming from the Asian region. That we can say like 1 in 4 children are facing from stunting. Similarly, for the wasting also, 50.5 million children around the world are facing from wasting, that is low weight for the age. So around 15.9% is actually coming from the Southeast Asian regions. We can also say that developing countries have a major contribution in this. So my study mainly tries to investigate the spatial inequalities and spatial dependency of malnutrition and its determinants over the last decade by identifying the spatial patterns at state and district level, and also trying to investigate the spatial dependency and the influence between malnutrition indicator and its determinants. For this, we have adopted the path. We have come up with a framework which is adopted from the UNICEF conceptual framework, which is derived in 1990. There are the factors which affect the child nutrition outcomes are interconnected. There are series of factors, but from this we have developed our own framework, as you can see here. So my independent variables are so as follows, like mainly grouped into 3 categories. One is immediate, nutrition, and underlying. Immediate are mainly focused on diet and the maternal factors. Nutrition are the government schemes, underlying are the social causes. These are considered as independent. Dependent are mainly the indicators of malnutrition, that is stunted, wasting, and underweight, which are coming from anthropometric data such as sex, age, weight, and height. So this is my methodology. First part would be focusing on identifying the spatial patterns from hotspots and closed spots using spatial autocorrelation method. Second part would be focusing at the state and district level, trying to find the factors which are influencing the indicators, such as I already spoke, independent variables influencing the dependent variables, where we have adopted regression models, and the best fit model is considered over here. So I can try to show some results over here. These are my spatial patterns and the hotspots which I could find. Around 236 districts in India are actually having severe malnutrition, above 40%. These cutoff ranges have been adopted from WHO. And these districts are mainly in northern part. You can see for the wasting, around 472 districts are mainly suffering from wasting, above 15%. These cutoff values differ from stunting, wasting, and underweight. And these patterns can also be seen mainly in central region, and it's uniformly distributed. Only we can say like around 84 districts which are actually coming in like below 10%. So for the underweight, we can see like 370 districts which are suffering from underweight, which are seen in north and northeastern part of India. So after finding the patterns and the hotspots and cold spots, then we try to investigate the factors which are contributing these indicators, like contributing to stunting, wasting, and underweight. At state level, we find that mother with low BMI is the major factor. And at a district level also, peculiarly, we were able to find like mother with low BMI is the major factor which is influencing. Around 136 hotspot districts are found, which are having like low BMI and also having stunting as a major factor. Then when it comes to the nutrition specific interventions, these are the interventions which are done by national and local governments. We found that antenatal care is the most important factor, like the care that is given to the mother before the birth of a child, antenatal care. So this is the most important factor which it is lacking. Even the government schemes are not trying to push further, so that there is an infant mortality rate which is mainly being contributed because of lack of antenatal care given to the mother. This is also done. The data is actually coming from the government data, so we are considering the government hospital data, mainly from the rural areas. So for the next part, we have considered like social factors which are influencing at the state and district level. At the state level, we have like a women married before 18 years, like early marriage is the main factor which is contributing for the malnutrition, which is similar for stunting, wasting, and underweight. But at a district level, sanitation and early marriage are contributing. Like a lack of sanitation facilities, which actually did, contribute to the different diseases, has been known. And it is also explained over here. So from my study, we have found that there is a from the conclusion of this study would be the hotspot areas are better reference points in formulating the policies and interventions, mainly because we found out that hotspot areas are changing from state to district level. So the national policies wouldn't be applicable to the state level and sub-district level and community level. So you need to find the factors which are influencing at a community level and at district level. And these factors are changing, and mainly the hotspot districts are Bihar, Uttar Pradesh, and Madhya Pradesh, and Rajasthan, Uttarakhand are hotspot districts for stunting, wasting, and underweight. Low BMI and such as like maternal care is the most important factor where that contributes to the highest amount of malnutrition in the form of stunting, wasting, and underweight. So the government can actually combat the malnutrition by doing early intervention by considering the maternal care as the most important factor. And also, first 1,000 days of period of mother being pregnant is a crucial period where they can take the care by giving the vitamins and minerals to the children, as well as the care to the mother in terms of prenatal care and postnatal care. And sanitation is a most serious problem, but data was from 2016. But when it comes to 2018, the situations has been improved, but we are still waiting for the data to come out. I hope my conclusions would actually help the policies to come up with a local level policies and better policies to combat the malnutrition. Thank you. Thank you for this opportunity given by Second International Conference on Disaster Resilience and Sustainable Development. Thank you.
Yes, thank you very much. Now we proceed with the two final presentations, and we are delighted to move to a different region now outside Asia. We are moving to Sudan, and I see Dr. Ahmed, you are also online, so welcome. And we'll hear from Dr. Ahmed on community perception of flood-induced health risks in Sudan. Please proceed.
Hello everyone, my name is Ahmed Abdelkader Babakir. I am an alumnus of AIT, Disaster Preparedness, Mitigation and Management. Now I work for World Health Organization in my home country, Sudan. I am very happy to present to all of you my paper entitled Community Perception of Flood-Induced Health Risk in Sudan, a case study of Sherganil area. My co-author in this paper is Dr. Indrajit Pal, Assistant Professor in AIT and Chair of Disaster Preparedness, Mitigation and Management. As we know, the most frequent natural disaster in the world is floods. It is the deadliest and costliest natural disaster in the world, and Sudan is not an exception. Floods in Sudan cause damage more than all other natural disasters. Nevertheless, the frequency and impact of floods are expected to increase in the future due to the effect of climate change and increased exposure. The impact of floods on the population's health is very huge. It increases the risk of the communicable disease such as malaria, cholera, diarrhea, and measles directly through the contamination of drinking water, interruption of routine disease control activities, and creation of disease vector breeding sites, or indirectly through overcrowding induced by people displacement and related power cuts that may affect water treatment and cold chain that in which vaccine and drugs are saved. Along the history, Sudan's floods are usually associated with secondary disaster of disease outbreaks. Each year, during the rainy season, and especially at the wettest months of August, the incidence of many of infectious disease increase markedly. Despite the repeated flooding event and its devastating effect in the study area, still the role of the local people in the preparedness and response activities is usually very weak. Each time after disaster subsided, they return to live in the same area in more vulnerable situation. So we need to know what is in their minds. How do they perceive the risk? And why they don't change their behavior. We are targeting their risk perception to change their health behavior, as it is evidence that interventions that successfully change the risk perception will subsequently change or enhance health behavior. The main purpose of this study is to assess and analyze how the community of Sharganil area perceive the risk of flood and its related health risk, and the effect of their perception of over their attitude, and to assess the technical capacity of the local government employees and community leaders to deal with flood disaster. This could be done by examining the knowledge, the awareness, and attitude of the local government, local people, community leaders, and local government employees in the area. The methodology. The study was a cross-sectional study, community-based, descriptive, and analytical study, cross-sectional study. Both qualitative and quantitative data were involved in this study using close-ended questionnaire, focus group discussion, and key informant interview. We have carried out 6 focus group discussions and 19 key informant interview. 19 key informants were interviewed. Sampling technique was cluster random sampling, and the household within the cluster were selected using the systemic random sampling. Sample size was calculated using the Cochrane's formula, and results were interpreted in the form of chi-square, regression analysis, reliability scale analysis, percentage, and mean. The main results of this study are that the local people of the study area have quite optimistic risk perception. That means that the real risk in the area is much higher than the perceived risk. And their attitude toward health problem during flooding situation is unsupportive. They have unsupportive attitude. The local authorities have poor capacity to deal with flood and its related health risk problem. Unfortunately, there is no early warning system in the area. And if we came to some details, we can notice that the vast majority of the local people have poor knowledge and attitude toward health and flood risk in the area. Awareness can be acceptable or could be considered as acceptable when it is compared with knowledge, but generally it is also poor. According to the chi-square, we found that no association between awareness and any other variables, neither knowledge nor experience. So the optimistic risk perception is the main driver of the community's vulnerability. As it is evident that people who have pessimistic risk perception, they will take action, protective action, and they will try to build their resilience. The study has now provided a solid ground that can be relied upon to enhance risk communication in the future. It is also can be used to endorse the indigenous knowledge of the local people for the future preparedness and response planning, and also can be used as a baseline that is comparable to assess the improvement in knowledge and awareness in the future studies. Recommendation of the study: we need more engagement of the local people in all stages of disaster management activities in the area. Also, we need excessive campaigns of risk communication with public. The local government officials need more training or excessive training to build up their technical capacity. We need to strengthen the health regulation and legislation, and we need to build an early warning system in the area. Thank you for being patient, and the door is now open for discussion. These are some references we used in this study. Thank you very much.
Thank you, Dr. Ahmed. We are swiftly moving to the last presentation. We are moving to Bangladesh. Dr. Baizal Islam will present on COVID response by municipal authority with the help of community-led organizations. Please proceed, sir.
Good afternoon, everyone. I am Baijid. Today, I am going to present on behalf of my team. Our topic is COVID-19 response by municipal authority with the help of community-led organizations during lockdown. And we captured information from Cox's Bazar, Bangladesh. This is a coastal city and around 400-kilometer drive away from the capital city, Dhaka. And in this city, there is a good number of active community-led organizations. They actually helped different actors, I mean, the different offices during the COVID-19 crisis. So now I would like to give some basic information. In Bangladesh, the first COVID-19 case was identified on 8 March 2020. And in our study area, in the Cox's Bazar, the first case was confirmed on 24th March. To control the COVID-19 virus transmission rate, the government of Bangladesh declared lockdown on 26th March. But the nationwide lockdown actually disrupted the daily life and as well as the COVID-19 response and relief operation. But the community-led organization came forward to assist the response activities of the municipal authority and other actors. Our objective of this study was to look into the action taken by the municipal authority to respond COVID-19. And the second objective is to investigate how the existing community organizations supported the COVID-19 response. Here we interviewed the Cox's Bazar municipal officials, community facilitators, leaders of a community-led organization to get the required information. Since I'm talking about the community-led organization, here you can see one very common basic structure of the community-led organization. The first tier of this structure is the primary group. One primary group is composed of 20 members. One person from one household come to form a primary group. With the 20-person, one primary group is formed. The second tier is community development committee. Here, 10 to 15 PGs primary groups participate to form a CDC, Community Development Committee. There are 5 members. There are 5 members in this committee. Then the cluster. 10 to 15 community development committees participate and form a cluster. Then finally, the federation. All the CDCs and clusters attend in a selection and form a federation. Here is also 5 members in a federation. In one city, there will be only one federation. So now our key findings. As a part of the national preparedness and a response plan for the COVID-19, the municipal authority took immediate steps to ensure life-saving assistance at the community level, which includes food supply, cash distribution, installation of hand washing devices, supplying hand washing soaps, spraying disinfectant, etc. But the problem is the municipal authority faced challenge in reaching the target beneficiaries, mobilizing relief goods because of the suspended movement and the lack of human power during the lockdown. Actually, during the first phase of the COVID-19, even workers were not interested to get involved in the service. Also, the medical officials, they demanded special compensation for the service during the COVID-19. In this situation, the community groups acted as a risk communication focal, because sharing information through two-way communication is considered as a life-saving aid, and the leaders of the community were found to be successful in establishing the communication with the different offices. Next, community groups helped in rapid need assessment and gap identification. Need assessment is a crucial part of any kind of response, and the groups from the community fit this process well. Then relief distribution. The municipal authority actually adopted household level distribution to avoid the queue. But this process actually required a large number of population, and the primary group members actually came to support this activity. Next is trust building. Community groups helped in trust building, because during the lockdown, it was almost impossible for an unknown person to enter a community, but it was easier for the community leaders to enter in their own community. The community groups ensured functionality and supply of the hygiene materials. A large number of hand washing devices were installed in inside the community, and the community organizations took the responsibility of operation maintenance of these structures and devices. Next, community groups acted in panic reduction, awareness, and rumor control, etc. Actually, with the spread of COVID-19, there was a spread of misinformation and rumor. So the authority, the local government, the local government and other actors, they disseminated the right message through the community groups. Next, community groups started production of public health items. During the beginning of this crisis, there was a shortage of supplies. Actually the hygiene materials, masks, etc., from the China. So few organizations, community organizations, they started production of masks in Cox's Bazar. So we have already reached in the last part. In the conclusion, we have the 2 points in the conclusion part. The institutional setup of the community-led organizations is likely to help protect the community in the next wave of the COVID-19 if it arises. And the COVID-19 has also made us feel the necessity of well-established community-level pandemic response strategy, including risk communication standard operating procedure, SOP. This is the end of our presentation. Here I mentioned on reference from where I took information. Thank you very much.
Thank you very much to all the 10 presenters. I'd like to hand over the floor to Professor Sylvia. I hope we'll be at least taking one question as we are a bit running late for our second keynote session of the day. Professor Sylvia, would you like to raise some issue for discussion? Thank you.
Yes, I would like to invite two questions because I think we are already running over time. We've heard from many different presenters. I would like to give a chance to the participants to ask two quick questions. If there is anyone who has a burning question, just speak directly. Please speak, don't hesitate. Please just speak directly.
Professor, we will be not like taking questions from the participants live. I think we can pick up one question from the chat box itself and head for discussion, I guess, for a short discussion. Thank you.
So that's a pity, actually. That's a pity that there is no live interaction. I'm not sure actually what I can say. I mean, what I was very intrigued by is the presentation on the business aspect, because I think we, and I'm a social scientist, so I study a lot about, you know, the determinants of malnutrition, determinants of poverty, inequality, etc. But we do not hear so much about the business aspect, which is quite critical. So I would like to also ask about this a little bit, whether there is any chance to also maybe expand the sample size, because I've seen the response rate was a little bit small. I was wondering whether there's any chance to expand the sample size and maybe do some comparative cross-country case studies, because I think that's quite an interesting aspect. If I could request the professor from Japan just to give a short comment.
Okay, please hear my voice, okay?
Yes, Professor, very clearly. Thank you.
Okay, so about social aspects, yes. In Japan, Japanese pandemic is not so big, but social damage is very big, especially for several industry fields, such as tourist or sightseeing industries or hotels or restaurants or like that. And now that impact is continuing. So and now Japan has big challenges to host Olympic Games. So now, so how to control the pandemic situation and how to control the business situation, especially how to yes, we need to shrink the business to control the pandemic, but business sector claims governmental control. I think so. Each country has their systems, and Japanese system is very weak to control pandemic because Japanese national government cannot order to stop business of private companies. So it's only voluntary basis. So that is, I think, very big characteristic in Japanese pandemic situation, especially for private companies. Okay, sorry, that's my answer.
Thank you very much. That's
okay.
Thank you very much. I think that's very helpful. I don't know whether we still have time for one more question or not.
Professor, yes, I think we can head for a short question. Thank you.
Very final one then. I see that there are many questions to our colleague from Japan, but I think we are also interested in other topics. I'm also interested very much in the topic in Sudan, and I was wondering to what extent also we have the combination of the pandemic, we have the combination, of course, of natural hazards and disasters. I was wondering to what extent, Dr. Ahmed, you were also able to incorporate, factors related to political instability and governance. If you could just comment on this aspect very briefly.
Okay, thank you. My answer for this question is that my research was done in 2019, before COVID-19 pandemic. So the study was in 2019.
Oh, I see, because I think the session is about COVID, so that's quite interesting. So I think I would recommend if you could redo this kind of study, to see also the combined effects of COVID, that would be very interesting. And I would also recommend to incorporate some governance factors. I think that would be more also comprehensive. Anyway, I think we are running out of time. I would just like to thank very, very much all the participants. I've been really delighted to hear all those interesting talks. And I think, as the organizers have indicated, we still can continue through the networking path. So I would invite the participants to continue in this way, and then also to obviously connect individually if there are any questions to a specific participant. I think there are email addresses provided. Thank you very much. Have a wonderful day or evening, depending on where you are. And it was really a pleasure to be here with all of you.
Thank you so much to our co-chairs, Professor Sylvia Szabo. We couldn't unfortunately have Professor Victor Ho, our second co-chair, for this very technical session. Thank you very much to all the 10 presenters for your wonderful presentations and prompt response that was going on the chat section as well. Further questions will be taken to Padlet for further questions. If you have your queries, can be posted in the networking lounge or Padlet itself. So we unfortunately couldn't take a short break here, as we will be heading now to plenary hall for our very special keynote session 2. We have dwellers and stakeholders in the Asian mega deltas, their contributions to locally led adaptation and resilience. So ladies and gentlemen, I'd like to request you to head to our plenary hall. That's hall 1 for the keynote session. So thank you all for joining. Thank you.